Thank you for joining us for CNTV. I'm Brad Clonch along with Quin. We're at the 1-year mark of the COVID-19 pandemic.
Mitigation efforts kept us apart here on CNTV, but we found new ways to connect, to make it through this journey together. We're connecting our community.
Technology and online resources like Zoom helped us stay in contact with Chickasaw citizens, health officials, and healthcare workers. We asked this panel of healthcare professionals on the front lines to share their thoughts on the past year.
Just from beginning to the end, just knowing every operation that we've completed, implemented, the direction we're going, it's actually kind of an exciting time right now. I remember being exciting to hit the 10,000 mark of vaccines given, just to keep going. It's kind of exciting for me right now. It's just to keep looking at those numbers dropping for positive cases and increasing in vaccinations. And then again, just working with all the different departments to make this happen. Chickasaw Nation's kind of like my family, my work family.
I've really become more grateful for all of my family, all of my friends, all of my work family. I think being grateful to be able to take a deep breath of air is just kind of the foundation of what this has taught me. One of the biggest things is how everybody has come together to fight this. Every different department, everybody from all different specialties have constantly worked together, looked at the research together. I feel like our brains have been crammed full of new information constantly, and we're constantly trying to keep up, and everyone's done a really great job of it. That's one of the positive aspects. You can't help but look back on all the lives lost. We've lost a lot of people, and it's really heartbreaking to think that, a lot of those people would still be here with us if it wasn't for the pandemic.
I don't know, you stop and you think, because there's times when we didn't know if we're going to make it through. I'm just being honest. There was times when you're like, is this ever going to end? What's this going to look like for us? And now that the vaccines have been here, we've got that little bit of light at the end of the tunnel. And so I guess my trust was just working with, like I said, we're so blessed to work for the Chickasaw Nation. I wouldn't have wanted to work anywhere else during this pandemic. Just like Dr. Burden-Greer said, this has been an amazing place. They take care of their people. They take care of their teams. They give us the tools. They give us the tools to take care of people that we need to take care of each and every day. So I just reflect back and just say, thank you for that. And I don't know. It's just been an amazing time in my life. One that, we'll never forget. Never thought we'd be here to start with, but man, we'll never forget it.
It has been an unforgettable time and a long journey.
That journey has included Chickasaw Nation health officials with updates on COVID-19. In this episode, they reflect on the toughest days and the turning point of the pandemic.
Well, sometimes it's hard for me to believe that it's been a year, already. And then there's other times that I feel every day of it. It's been a lot of long days and weekends and a lot of trying times, but a lot of really wonderful times too. And whenever I look back at all the things that not only our teams in health, but really the tribe has accomplished. All the operations we've put in place, departments that we never had before, like contact tracing that are now in place. And I guess one of the things that as I reflect, it reminds me how important people are, to our organization, to any organization really, but the fact that they have come together like they have cross-departmentally, as well as within the Department of Health, across all of our departments to do the things that we've done. It's simply amazing, what we've accomplished in the past year.
What would you both say was the lowest point that you remember during this pandemic?
I think the low for me was watching one of my staff members cry at the bedside over a patient, and I asked who that person was, and that was somebody that they had interactions with every day in their normal life, and now they were having to take care of them and having to tell the family that there was nothing more they could do for this patient. At that point in time, you just have to rely on a higher power to get you through that. There has to be, you have to rely on one another and lean on one another as human beings, we've lost over 500,000 people in the United States. That's a permanent event for many families. And we don't take that casually. So I can guarantee you that the folks that work in our hospital, that work in healthcare, that have lost loved ones, they don't take that casually. They fought as hard as they could for each one of those patients each time. And so watching them fight and feeling helpless, that was a low point.
There have been a lot of low times on and off throughout this. It sort of ebbs and flows along with the things that you're having to deal with. And each of those have left an impact on me. And as John said, probably will for some time to come.
What was the turning point for you?
When we finally had a vaccine that we knew was going to be successful against this disease. And it was so remarkable that the first couple of vaccines out of the clinical trials happened to be 94 and 95% effective, almost unbelievable, the high level of effectiveness. And now we have a third one on the market, which is created a little differently, is only a one-shot, vaccine, still very high effectiveness. And so we finally have tools to prevent it. We still wish we had more tools for treatment, but for me, getting that vaccine out, seeing this last surge we've had start to tail off a little bit, and hoping it's going to be the last one, but we don't know that for sure yet.
It's a normal for a virus to surge, and then the surge will eventually just die out, kind of like a forest fire does when it runs out of available oxygen. But what we're trying to get to now is the smoldering. The virus is still smoldering out there. And what vaccines are going to do very well, if we get them at adequate levels, is to actually put out the smoldering fire that's still there. As the virus starts to get desperate to infect another person, that's actually when that environment, we consider that what's something called environmental pressure. So as viruses fall under environmental pressure, they change their characteristics to try to become infectious again. Well, we don't want that becoming infectious in the sense that it could outwit some of our vaccines. So that's why you see this big push right now to really knock down that smoldering amount and get it down to the lowest possible amount. We will not eradicate coronavirus, but we will get it to a level below which it's probably not going to break out again. Even though we've done great things here and we are doing our part, there's a lot of other people doing their part as well around the globe, and it's making a difference. It's a testimony to the human spirit, and it's a testimony to grit, and that we're not going to get wiped out by some virus. we're not. That doesn't define who we are. We can overcome huge obstacles and be successful over time.
The Chickasaw Nation has done remarkable work to protect tribal citizens, employees, and communities during this pandemic. From testing to vaccinations, the tribe has reached thousands of people.
The Chickasaw Nation is offering COVID-19 vaccines at no cost to all area residents. There are no tribal citizenship, employee, or state residency requirements. The drive-through vaccinations are located at the Ada Emergency Operations Facility and at Chickasaw Nation Health Clinics in Ardmore, Purcell, and Tishomingo. Go to the web address on your screen for more information and to schedule an appointment for the vaccine.
National Public Health Week is April 5th through 11th. It's a time to raise awareness about public health. The Chickasaw Nation has several programs and resources for public health that promote exercise, prevention, physical and mental wellness. During National Public Health Week, learn about these areas and topics. Here's more from our conversation with Bobby Sankey, Director of the Division of Research in Public Health at the Chickasaw Nation.
It is a very wide-ranging definition, and it does involve so many different areas, but I like to keep it simple. So to me, public health is the creation of those conditions that improve and protect the health or overall well-being of a given people or a community, right? So it's creating those conditions that improve and protect the health of a community. Public health is much more than just health. When you talk about public health, people just hear the health part. Public health affects every aspect of our lives. A more holistic view of a person's health. It's not just their clinical care or their clinical treatment. It's all those things that make a person healthy in mind and body and spirit. It's what we call social determinants of health. Things such as where you live, where you play, who you live with, where you go to church, whether or not you have a good job, whether or not, your education, all those kind of things. All of those impact your overall health. And so that's what public health is. Everything that we do, all the services that we provide are really geared toward maintaining, improving the health of our community. So it's culture culture of health across the whole Chickasaw Nation.
I find it unique that the Chickasaw Nation has a dedicated, designated division for public health.
Just providing basic clinical care is the main focus of most tribal health systems. Chickasaw Nation, we are blessed with clinical facilities that will rival anybody's, right? So we provide already that clinical care. So that allows us, I think, to look beyond the health system, the clinical care health system, which is extremely important, right? But it allows us to look a little beyond that into prevention. So to me, the fact that we have a dedicated public health department means that there's a commitment to long-term planning and to the long-term health of this community, that you can't just that you can't necessarily measure immediately. It requires vision. It requires a long-term vision and saying, hey, trust the science, trust the public health science. If we do these things, it will eventually have an impact.
Do you see a transformation in people and in communities thanks to public health?
I do. I really do. And I think, and not to harp on the pandemic too much, but the pandemic has really drawn a lot of this together, has really brought public health to the forefront, right? This pandemic has really brought an awareness of how important it is to have a sound public health infrastructure, so that when these type of things happen, that the infrastructure is already there. Our public health department is going to come out of this experience a much transformed public health department, just from what we've learned, from what we've experienced. A lot of what we had done was, particularly in a emergency response, was kind of theoretical, right? Well, it's not theoretical anymore. And so I promise you that what our department will be transformed by the work that we've done, by the things that we've been asked to do, and the things that we've been able to do in response to this pandemic. And so, yeah, I think public health is here to stay.
Each day during National Public Health Week, a Chickasaw Nation program will be featured on the tribe's website and social media platforms.
They will be featured during National Public Health Week. Again, that's April 5th through the 11th. For the first time, the Three Sisters celebration was held virtually due to COVID-19. The celebration took place from March 17th through March 19th. Viewers from around the world tuned in from the convenience and safety of their homes to enjoy the online event. The celebration highlighted Chickasaw history, language, culture, and traditions. We learned about the ancient method of gardening, growing corn, beans, and squash together. Those crops are referred to as the Three Sisters. You may still view the online festivities even though they've aired. Just go to the Facebook link on your screen. We're so glad you connected with us for this episode of CNTV.
Brad and I will see you back here soon for another edition of CNTV.